We want people to know that when they're feeling isolated, when they're struggling, when they're in the depths of despair and they feel that there is no one to turn to, that there is an organisation out there that is there to hear them. The counselling helps in a number of ways. In the first place, it's someone outside of your immediate family who you can be totally honest with, who you can trust. It's a confidential space, so nothing that you say is going to go anywhere else. It helps because people feel as though they've got somewhere to bring it, and because our counsellors are very skilled, they're all highly qualified and experienced in working with people with cancer, they're able to work with you to facilitate you going through that process, dealing with the emotions that come up and finding ways to cope with it. Well, there's a whole range of emotions, and you know, they partly depend on when they come in the sort of cancer journey, if you like, because people can come when they've just been diagnosed, they may come in the middle of treatment. Very common time for people to come is after treatment, when people feel terribly lost and alone. They may come several years later, having not really sort of processed the experience. They may come after somebody has died. So the emotions can range from anger, disbelief, sadness, huge feelings of grief and loss. People feel lonely, they feel isolated, they feel bewildered, you name it. It's quite common for people to bottle things up, whether they're the person who's the carer, whether they're a family member, or whether it's the patient themselves, because often what happens is that people, whether it's the patient or the family members, they want to protect each other, and they feel that if they can contain their emotions and not show them, then it'll make it easier for everybody else. But actually it often makes it harder, and it certainly makes it harder for the individual concerned, because quite often they just feel so frightened. These kind of emotions can manifest themselves in all sorts of ways. People might find themselves getting very angry with people at home. They may cut off emotionally. There can be family arguments. If they're still at work, especially if it's people who are family members or carers, they may have difficulty at work. Children may struggle at school. They may not be able to get on with their peers. It can manifest throughout every aspect of your life, really. We see around 150 clients every year. We offer more than 2,200 sessions every year, but we know that that's only the tip of the iceberg. Everybody has seen the statistics for cancer. We know that there are many, many more people out there who are going through those complex, those difficult feelings and really struggling with their cancer journey, and we want to be there to be able to help even more people.